In this field, burnout is a normal part of this job. Chronic stress and exhaustion is the norm. Built from the struggle of differentiating empathy from sympathy.
Burnout and moral injury are critical issues in this field. They contribute to an increase in staff turnover, disruption of services, high caseloads, reduction in quality of services, and difficulty with retention and recruitment of staff. All healthcare and social services are facing a staffing shortage crisis, and some of this can be tied to burnout and moral injury. As social work students, Cassie and I explored the factors of systemic burnout and how to organize workers, the community, and agencies to advocate for systemic changes to reduce burnout in the field. In our research, we discovered an abundance of information on burnout and self-care, but as the individual's issue to address. The majority of the research does not address the systems factors that are in play. By systemic factors, we mean legislative barriers, bureaucracy, the red tape that divides the resource from the client, agency policies that are not congruent to work-life balance, and financial barriers, among so many more. The broader field and the NASW must take note of systemic burnout and build awareness for a call to action. Social workers are known to create change on the micro, meso, and macro levels. We believe with more awareness and collective action, social workers can effect change to reduce systemic burnout and its consequences.
Hi, my name is Jennifer, and I am currently working as a bilingual therapist.
My name is Hillary Hustana. I'm a licensed clinical social worker. I work in community mental health, and I work in child and family outpatient services.
My name is Heather Hunter, and I am a competency restoration educator.
My name is Alondra Escareño, and I'm a social worker.
My name is Amanda Kane. I've been a clinical case manager. This is my 8th week, but I also was a peer specialist for 10 years, and I've done mental health advocacy for 15.
My name is Claudia Martinez, and I currently work as a clinician for a mental health clinic.
It's holding your breath when you see you have voicemails.
It ebbs and flows, right? There are weeks, there are days where you feel more burnt out than others. And then there's the big burnout, the I can't do this anymore, which is why I left my first team. So a little bit burnout for me is just those days where I'm feeling exhausted, fatigued, but that there were bright spots in my day. The big B burnout happens when those bright spots no longer happen.
Have I been burned out? Have I been burned? Like, most definitely. But I don't feel like it's a property that's located in me. It's definitely a reaction. And for me, I also would describe it a little bit more like moral injury than necessarily burnout. That distinction does feel important to me because it feels more systemic than like a reaction to the individuals that I work with, and it's most certainly not a reaction to the individual people that I work with.
So we have burnout and moral injury, right?
Mm-hmm.
We have burnout defined as a type of stress that's related to professions who work with people. Those symptoms are emotional exhaustion, depersonalization, reduced personal realization at work, which means a negative attitudes towards work or towards one's own professional capacity.
Yeah.
Moral injury is defined as harm that's caused to a person who either perpetrates, doesn't prevent, or witnesses acts that violate the person's moral compass. This causes distrust that people or entities will behave in an ethical manner. These terms, they have different definitions, right? But we have chosen to use them interchangeably because they share those systemic factors. And also burnout's like a very popularized term, so it's easy to use, palatable.
I really try to push to continue going to work and being there for my clients, but the way it came out is towards the end, I felt a lot of compassion fatigue. I wasn't able to really empathize with my clients anymore. And that's when I knew that I had to leave. I had to take a break because I wasn't doing anyone a service, not me or not the clients.
if I'm being realistic, like there's been a couple times where I've had to cry myself to sleep because I'm just like, I do not want to go to work. It when I get stressed too, I have a really hard time sleeping, and I do feel it in my body. Like I get the same like back pain. I know when I'm stressed when my back hurts really, really bad, and it's to the point where I can't stand it. So I'm just like that's how I know that I'm really stressed out.
Depending on how bad burnout is, it could be this huge turnover. I know I stepped away from mental health for 2 years, so that's why I've only been at this job for 2 months. So I think even if they take a leave or take more time off, if it's sudden, then there's a lot of panic and like, okay, who's gonna cover this? What does Bob need? And
the people themselves hated being thrown into somebody else's caseload. Oh, this is the 4th case manager I'm with in a year, why am I going to get anything? And then they have to repeat themselves, and they have to go through everything where the other person left off, and maybe some things got thrown off along the way, and so we have to restart certain things again, and it's just like, you're not getting anywhere, right? And it's taxing on the client as well, because then they're like, you guys can't even get it together. You keep changing me case managers. It makes it seem like you're disorganized. If you're disorganized, why am I trusting you with helping me if you're so disorganized? You don't even know. I already repeated myself. And they don't see us as individual case managers, like, well, this is me now. They see it as, no, you, the company. The company is not put together. The company as a whole is treating me poorly because the company as a whole doesn't know what I need. And it's not that. It's just that it's interchanging, and people are constantly leaving and not sticking around, and it does that to somebody,
So I think, unfortunately, the system is set up for you to be like, this is a good first job. This is not your forever job, which is sad. Because then you just keep creating. There's no stability. There's constant turnover. There's no stability. And then you don't also get that expertise because people leave. They get their hours and then they go. And I understand why. I get it. I totally get it. But it seems like there's not a good solution.
You cannot provide care to someone who is in a situation where they need immediate help and they have to wait months on end for an intake. So, having said that, is that because, where does that come from? Does that come from the fact that you're not treating staff well? Or does that come from the fact that you're overloading staff and they don't want to stay? Or does that come from you're not paying staff enough? So I don't know. I don't know those answers.
Both the research and obviously in our interviews over and over again and our questionnaire that we sent out, people talked about how burnout manifests in physical ways and that there are physical health consequences from burnout.
Yeah. And I mean, just talking alone about the physical consequences, right? You have the loss of appetite, the anxiety, the poor sleep, low distress tolerance. I mean, I think that's a huge one that a lot of people really mentioned, especially in the questionnaire, because they feel like they can't talk to somebody without feeling like they're going to get upset or without feeling like that they are just drowning. And that isn't just mental, that's physical, right? You start shaking, you're getting that anxiety, you physically can't sit still. It's more than just that mental capacity. It is a very big physical thing, and especially when it comes to poor sleep, right? I know that I'm cranky if I don't get sleep. How do you expect me to talk to people, right? And if you're not getting sleep because of burnout, because you're thinking about work by the time you go to bed, you're thinking about work the moment you wake up, you're having dreams about work, right? That's going to add to the distress and that feeling of dread of having to come to work. It's we no longer have that want to help because of that burnout. When your professional life bleeds into your personal life, feeling as though everything feels flat and gray.
I was challenging a provider. It wasn't working, and then I got pushback from like the probation officers too. So I'm like in the middle, and I'm so tired, and I know what should be done, but I can't because I'm not getting permission from the people that I need permission from.
And so that started getting really frustrating and wearing. Now in mental health, I started to see that it's pretty much the same thing. There's not enough therapists. There's never enough medications, or they have red tape around the medication. Medicaid doesn't cover certain things. So having to deal with all these extra systems on top of helping the person gets really frustrating, because I can only see how they get frustrated in trying to just get their needs met. And then here I am thinking that, oh, well, they'll listen to us because I'm a case manager, or I have a workaround, or sometimes they feel that we have workarounds or magic wands. I could get them housing suddenly. And then I find out it's like, that's not the way it works. The lists are endless. The things they have to do to get in there are one thing after another, and they don't tell you that stuff up front.
We see that. And also as a bilingual professional, I have had to do extra work translating documents when that's not my role, and that can lead to burnout easily, because I'm not getting paid for it. It's just something I'm doing extra because I want to help my community, because I work with mainly Spanish speakers, and my company is not doing everything they can to translate those documents. There's a lot of legal reasons they can't translate certain documents, copyright, but I feel like they can find ways around that to help us, the employees, in order to also help the community.
I don't think that our mental health is being taken into consideration, because we are being pressured, because we are being told like, oh, like you have to meet this requirement on a weekly basis, or you have to meet this requirement on a monthly basis. And so it's like your mental health kind of goes out the window. And it's like, okay, if I'm meeting with clients back to back, I'm lucky if I get a 10-minute break. I'm lucky if clients either cancel or don't show to their appointment. But sometimes that that doesn't happen. We do see clients back to back, and I think that's the difficult piece, where with so much pressure, sometimes you don't even have the time to kind of sit back and take in what happened in that session. You're just like, okay, you write your note within those 10 minutes if you have the time, or if you even get the break, and then you go right into another session.
Self-care is invaluable. It's something that values yourself and prioritizes yourself. Self-care means thriving versus surviving.
Self-care gets a bad reputation. I think, unfortunately, people think when they think self-care, or at least like when I think self-care, I think society, people think like, go on a vacation, get a massage, like, cool, like that's great. Those all require time, money. Like when I think of self-care, that's like the extra stuff. That's great if you can do it, if you have the time for it, if you have the money for it. But to me, self-care is about like literally taking care of yourself. Have you eaten today? Did you get enough sleep? Have you showered? Have you moved your body? Like really just the basic things that like we need to survive. Because when we don't have even those basic things.
I have a little bit of a hard time with the self-care, because I also feel like with my self-care, I feel guilty for doing self-care. And I think in my field, it's a lot of that. People always felt guilty about taking time for themselves, or not paying attention to somebody, or, whatever. And for my self-care, I do art. So I draw and I paint. And then for a long time, I was just leaving my projects there, and they were unfinished projects. And I just started seeing them piling up. And there's still times that I have to really force myself to take an art class.
If you got a paper cut, you're going to clean it out, you're going to put Neosporin on, you're going to get a Band-Aid. And if I'm getting a paper cut because people are walking by me with thousands of reams of paper, self-care needs to look a little bit different. It needs to not be self-care, it needs to be collective care, it needs to be community healing in action. The way it's taught in training programs is sometimes like, go to therapy, do some diaphragmatic breathing, smell some essential oils. And I'm like, okay, that's great if you like those things. It's not going to heal you from systemic trauma. You're just going to get injured with a few more paper cuts.
Self-care is a personal and systematic issue. Putting the burden on the individual person is completely invalidating and unrealistic.
I feel like my agency doesn't care, if I'm going to be completely honest. I feel something that I've brought up in my own personal supervision a lot is that within the agency, I feel like I'm just an income, right? It's, if I'm not making them any money, I'm not important. Just what's more important is like, are you meeting your productivity every week? Are you meeting your productivity weekly? Are you making this money? Is what I feel like that's what they focus on so much, which makes me sad because as a mental health agency, right, it should be important that your clinicians are mentally okay to provide services for clients who are coming in to see you because they need that help too.
So I think that's one part of it, is actually like having real focus groups with protected time to actually engage in a problem solving process. And we just need more funding. I mean, when it really comes down to it, like, I can want to not live in a capitalist society, and the reality is that I do, and we need funding if we're going to be able to get the ship to safe harbor.
It's just really hard and defeating to work in this field, to watch people struggle, and sometimes you feel completely helpless. And most people I know get into this to help, but it's not fair to people at all, nobody involved. And it's hard to help somebody when the system's not helping them at all, or us.
So we know, like, the helping professions, they're kind of stereotyped for this, like, martyrdom.
Yeah.
The staff, that they'll pour out everything that they have. They will give it all during work hours, after work hours. They expect nothing in return. This is like a field where people say, oh, well, you're not doing it for the money, right?
Yeah. And I feel like those stereotypes, those stigmas, like the systems alone, but also the employers, like they take advantage of that, right? They're like, oh, you're not in it for the money, so we're just going to overwhelm you. We're just going to overload you because you wear your heart on your sleeve, right? Like you do this for reasons, and you're empathy, and you're kind, and you just care about the world. And, that can contribute, if not anything, those are what contribute to just burnout and the moral energy or injury that like staff face, because they take advantage of everything that we give in this type of field.
Mm-hmm. And we heard time and time again in our interviews, I got into this field because I wanted to help.
Yeah. And it's like, how much is too much, right? Like,
Mm-hmm.
We, like you said, like in the interviews, like, but it's like, but now I don't want to help anymore.
Mm-hmm.
And it's like, that's the systems, that's the employers, that's everything taking advantage of it.
Down.
Yeah.
Mm-hmm.
It's the slow resentment that builds when clients have needs and you feel helpless to meet them.
Even though social work has some partial roots in political action and social justice, people really felt like the politicians aren't going to help me.
Yeah.
The political system, like, they don't understand. If they did understand, they don't care.
Mm-hmm.
We're not going to receive enough funding. And, it's not going to make a difference to advocate on that level. And I thought that was a very interesting response, because there are changes that can be made. However, you're stuck in that vicious cycle. And I understand what people were talking about. You're in that vicious cycle of, I am too exhausted by the barriers that I'm facing in my workplace,
Mm-hmm.
and just like trying to navigate all of these systems. I don't have the capacity to go advocate for change on that higher level. So there are certainly things that can be done.
Mm-hmm.
And it was very sad to hear people saying, I don't believe in this. I have a hopelessness. I don't think that I can. So one of the resounding themes that I've been seeing as we've been in this interview process is, in more or less words, a belief that the political systems that we have in place are not going to be invested or doing anything to address the political and other systems factors and barriers that contribute to the workers' burnout. So I am here at the Colorado State Capitol building today as part of my union's lobby day. And we are making sure that workers' voices are heard. The workers that are here today and the lobbyists have a direct impact on the political system to try to get that budget approved so that those workers can get paid more.
Maybe like working on some sort of incentives. I know that I worked on a peer specialist bill that was going through the legislation, and they had like a one-time tax credit they were working on, that if you went to school like for human services, that they would give you like a $2,000 tax credit, and that was just to get people in the doors.
Well, the Medicaid in general is switching to fee-for-service model, which unfortunately will do the opposite of make things better for us. I understand why they're doing it from like it doesn't look great to just like give organizations a bunch of money and be like, do what you want with it. So like I understand that they feel like they need more oversight, but unfortunately what this has created is it will just mean more work for us.
That's important, right? Like there's not enough funding for like mental health services. I mean, clients within the last couple of months, I've had clients stop showing up to therapy because of losing Medicaid.
Politicians coming and going and saying, yeah, we're going to do this, and then they don't. And they don't.
Don't think that things will change. I think that what'll happen is that funding will eventually get cut, and we will see less employees. And I think that with less employees comes more work. And I think that you get into social work because you care about people. And I think that you leave social work because you care about people and you care about you start seeing and caring about yourself. And so I don't foresee that will change. I think that regulatory agencies serve a purpose, but it's more of a punishment or making sure that social workers aren't violating the law. It's not about making sure that they're taking care of themselves. And I think that regulatory agencies rely on companies and nonprofits and individual owners of businesses to do that for their employees.
People are so burnt out from the work that they're doing, from the systems that they are coming up against repeatedly, that they no longer have the bandwidth or capacity to do things like this in their off time, because this does take a lot of bandwidth. And then you have the lack of hope that comes from that cycle. Oh, nothing's going to change. I can't actually do anything. Maybe I can just find an agency that's worth working at that won't be that bad. Or what I've heard a lot is having a direct supervisor that will make things bearable, or who can protect or shield you from some of those systems issues that lead to burnout. But that can only do so much. What if your supervisor leaves? What if the agency says to the supervisor, no, you have to follow whatever structure that the workers aren't able to keep up with? So really, the agency cannot always be relied on to address those systems issues, either politically or internally on that scale. The data and the research shows that burnout can be mitigated by having a direct supervisor in the social work field who is able to have open and honest conversations about the issues of burnout and moral injury, and also having a good team working relationship, having a good rapport with your supervisor, and getting adequate support. This can help mitigate those factors for workers to help them have a buffer or protection against some of the more insidious consequences of burnout. We even had one person in her interview say, I have these things that give me joy and help me, but it feels like a chore. It's like, oh, I have to do this, I have to do that. And now, like, going to an art class or carving time out for self-care is like a chore now. And so I can understand why people are hesitant to engage more, to make larger systemic changes, because that is another task, that's another chore. So it's interesting to look at, and I'm hoping that by bringing awareness to this topic, as we've said before, we may see some novel ideas for change, maybe see more action and awareness around this. That's where you got to start. Yeah.
I think the one thing that's important that I've been trying to practice myself is speaking up when you're feeling like you're either close to burnout or you're experiencing burnout just already. Because I think one of the things that I've done a lot being in the field is I just like sit there and I don't say anything about it. Until like now that it's gotten to the point where I'm just like, you know what, I'm fed up with all of this. Because I've gradually let things get, build up because maybe because I didn't think it was that bad, maybe because I didn't feel the need to speak up for myself and advocate for myself. So I think when it comes to this, what I think it's important is that even if it doesn't feel like it's burnout, even if you're unsure of what you're going through, like, speak up, ask someone for help within your agency if you feel comfortable, talking to anyone. I think what's been helpful for me has been my supervisor.
Social work is a change-making and social justice-oriented field. By bringing light to systemic factors around burnout by education, maybe we can empower agencies, communities, activist groups, other social workers, and political systems to conceptualize and remedy burnout in a different way.